ready?
Yeah.
For female catheter insertion, you begin by reviewing the chart and checking the medical order to make sure that the procedure is necessary. Once you've done that, you'll perform hand hygiene and put on proper PPE if indicated. You'll enter the patient's room, identify the patient, date of birth, name, check their ID band. Once you've done that, you'll explain the procedure to them, find out if they have any allergies to latex or iodine, and then if you're all good, you begin by having proper lighting, adjusting the bed to a workable height, making sure the patient understands what's going on, they're in a comfortable position before you begin. I'm going to put the side rail down, and then I would begin the procedure. So, to get them all set up, for the procedure, you're going to put on clean gloves first, which is difficult after you put hand sanitizer on your hands.
And dispense them. And I start.
Once that's clean, I'm going to.
I've already gathered all my supplies necessary for the procedure on the table next to me. Then you will roll this down to expose the area.
I'm going to insert until I get your retention. Once I get your retention, I'm going to put another 1 or 2
Take a waterproof pad.
at that point, I'm going to hold it with my non-dominant hand and inflate the balloon.
Place it under your patient.
That is saturated with iodine solution.
You would
And clean from
try to
top
put their
to bottom.
legs up like this.
Once I'm done, I
Just
do
kind of
this.
difficult when it doesn't
And
move.
I feel pull back and have resistance.
I
and then,
repeat.
Sometimes you need a second person to help you with this.
After that, I'm going to secure the
Slide it under the patient.
catheter to the leg to a comfortable position.
Lastly,
I'm
down the
going to
middle.
take a urine sample from the port down here.
Not sure how that's going to work out.
And then hang
And
it
then
back from the.
You would clean the area.
I'm
At
going
this point,
So you would
I
take your
just
rag,
point up the
make a
tray
mitt.
and begin to.
and deposit that in the proper waste bin.
When you're cleaning, you're going to make sure you don't use the same corner. So you're going to start off on one side and wipe from top to bottom. Rotate to the other side, top to bottom.
And lower that down.
Switch it
from
over
a
this way.
comfortable position.
Same
And
deal.
patient with any other needs. I'm gonna do hand hygiene. And
then-
that would be it for.
You would get ready to begin your sterile procedure. So you'd remove these gloves.
Two to 3 inches
What do I do?
until I see
Oh, I'm
your.
going middle side, or middle side.
Perform hand hygiene.
Insert another
That's a feedback thing I'll do then. What
And
time?
then you would
Sure, I don't
open
wanna
your
force it in, but
Alright.
kit. When you remove this, which mine's a little ripped, you use this as a garbage bag. So you would roll down the sides and place it up here on the patient's bed.
solution.
Then you would open your box away from you.
What? It's 'cause I just got it through.
Yeah, right, but mine wouldn't go, it just.
Get out your sterile gloves.
I didn't even think about that. Alright, ready?
Make sure the cut is facing
So
downward.
next, I'm going to
Press
take
down
them
the
out to the record for
syringe
removal, see
to
if the patient
push
has had
the
their,
sterile
Foley catheter
solution
removed.
With your non-dominant
So that
hand,
goes to the patient's
grab your
room.
glove.
Hand hygiene,
To
I'm
make
gonna put
the,
on clean gloves, I'm gonna
balls,
identify
make sure
the
it
patient
doesn't
with,
come out.
name,
Go
date of
under
birth,
this
ID
cuff.
band. I'm gonna get my equipment.
And I also forgot to mention earlier that
I'm gonna get my equipment.
I should have
There's gonna be a syringe.
Then you'll take
put
one of your
the
drapes,
tip of the catheter
Fluid
in
open
the
it up,
2 inches before inserting.
and then you'll put the shiny side down. I just touched the leg on accident.
I would.
You'll fold this side in.
Drain the bag out,
And then
remove that from below
Make sure you
the
don't go
bag.
over it
Once that is in
when you
place,
drop it in.
From
and
the
is secure,
patient's leg.
I
So
You'll
this is
continue
not
to use
completely
these
secure
to increase the length
Empty the syringe.
of your sterile
on
field.
the patient's thigh
It should throw up on
and
its own.
put the bag on the side of the bed. And there
I
should be a
chose
hook
to
for
use
it.
the one that
At
has
this
the hole in
point,
it
if I
down
need
here
to
instead of
urine
over the
sample,
area,
I
making
just
sure that
I'm gonna explain to the patient
where the
that,
hole is still covered up by that, the one above
I'm
it.
going to pull out
Then you would
the
take your
catheter.
tray
If you don't have a lab, then we can put it.
and drop it onto your sterile field.
Or in the refrigerator, so we can take care of that later.
And then
And
you would begin by
now to
opening.
the
First, I would take out
catheter.
these.
Tell the patient
I would put my iodine solution in here.
before
Dispose of that.
Yep, so balloon's filled up.
Remove
Take my
So,
lubricant,
before I do that,
squeeze it in there. Dispose of that.
And then I'm going to remove.
Use these to
I
fluff
pull
my
the syringe
cotton balls
back
in the iodine to make
so
sure they're
that,
completely covered.
It would come out of place.
And then I would
And I tell the patient to take a deep breath.
take my
before I
catheter out
remove the
of the
catheter.
bag by coiling it in my hand,
Yeah, right.
placing this
Also note
in the lubricant.
that,
I wouldn't fully drink
1 to
the
2
liquid real
inches.
quick, but at this point, I'm going to
And then
pull
taking-
out,
And
pull in my
I
hand,
coil this
and then.
and dispose of everything.
taking my saline and
Sure
placing
that's
that here.
Foley bag and a biohazard bin.
Position.
And at this point, I will pick up the patient on.
I like to pull a little bit out so that when I'm inserting it, I don't have to keep going back and forth. So once I've done that, I will begin
Hygiene.
to clean the area by spreading apart the labia
and
taking an iodine soaked cotton ball, wiping down one side, dispose of that, same deal top to bottom, keeping my hand, my non-dominant hand on the labia as to not break sterility anywhere else. And then once you do that swipe, you go right down the middle and dispose of that. So once you're at that point, you take your catheter and you insert. You tell the patient to bear down, and if you experience any resistance, just twist the tube a little. You're going to insert it about 2 to 3 inches.
Take care of yourself.
Once you get to that point,
It looks like, man.
you're gonna fill the balloon. So what I did was once there was urine exposed through the tube, then I went about another 2 to 3 inches.
If you're gonna go, since you already have your equipment out and all that.
Oh, sure, that's fine.
And then make sure to take this off right away or it will come right back in. So once that's in, you give it a little tug, make sure that the balloon is secure. And then you would clean the area if necessary. Afterwards, make sure that you secure the tube to their leg and then place your bag hanging underneath here. Get a urine sample if you needed to right now. And then clean up your station, make sure the patient is comfortable, get them back to a comfortable position, the lighting, make sure they're covered up, and then you're good to go.